Today we're going to talk about Quervain's Tenosynovitis. What that is inflammation basically at the base of the thumb in the tendons that run right along the base of the thumb through the wrist. These tendons are called the extensor pollicis brevis and the abductor pollicis longus. You don't really need to know those names right now because all that matters is it hurts and we're trying to fix it. What they do is they help extend the joints of the thumb. The most common cause of Quervain's is just chronic overuse of the wrist, either through gripping motions, lifting weights, lifting babies, carrying grocery bags, things like that. It's also called texting thumb because as we text so much, it starts to inflame those tendons there. The primary complaint of this is just pain on that side of the wrist. Not very far up and not over on the other side at all, but just right there along the base of the thumb. So what we can do to find out if it is Quervain's is we can start with some palpations. Palpations would start with the radial styloid process, or just the side of the wrist basically. The anatomical snuff box, which I'll show you here, if you can see it very well on my hand. It's this area right here where those two tendons run. So if you can see it moving just a little bit, it's right there. We're going to palpate in there and feel those tendons, and right inside of that. Those two tendons are the two tendons I previously mentioned. We can also palpate the first joint of the thumb and the soft tissue surrounding the area. So the thumb, the wrist, that area. Some special tests that we can do to find out if you have Quervain's or if there's another problem. We can start with the Finkelstein test. That's basically the only test specifically for Quervain's. And what you do is take your hand, put your thumb inside of it, wrap your fingers around it like a fist, and then just put your wrist down, like deviate it down. And if that causes pain throughout your wrist, and you'll know because it's pretty painful, then that is a positive sign for Quervain's. Another one that you could do is called the grind test. This is similar to the Apley's grind test that we do on the knee when we're testing for meniscal tears and things like that. Basically you do the same thing. You grab it, you push your thumb in, and then you just twist it, you crank on it. And if there's much sound, any what we call crepitus, then that's a positive sign for osteoarthritis. So you might have some other problems you need to look out for. There are some other nerve tests and things we can do, but they're not as applicable for this specific injury. We can also palpate, as we're palpating inside of the anatomical snuff box. If there's much pain in there, that could indicate a fracture inside of there. But if it's pain more through the tendons and through the wrist, it's most likely Quervain's. So things that we would do to get you started on your path to recovery, the first thing would be trying to just reduce inflammation. We can do that through a few different ways. We can use ice and we can use massage together, and we can also use immobilization. We can use a splint. There's a special one for the thumb called the thumb spica, I believe, and that will just keep your thumb immobilized so you can't move it and you're not using those tendons, and hopefully the inflammation will go down. If treatment is started early enough, if we catch it soon enough, you can usually clear this up within 4 to 6 weeks. The initial plan for treatment would include that immobilization, and then starting to strengthen the wrist, strengthen the grip, and really stretch those tendons out. So most of these things you can do at home. You most likely won't need to see a physical therapist unless it's very severe. And if it's that severe, then there's probably some other things that you're going to need to have done, which I'll talk about in a little bit. But these things that you can do at home, the first would be just stretching those tendons. So I'll come back around and I'll show you right here. So those tendons run right there, and that's right where your pain is going to be. And so you're going to lay your hand flat, you're going to press on those tendons, and you're going to bring your thumb down. Let it go, bring it up, press on them, bring them down. And it might hurt a little bit, but it shouldn't hurt a lot. And it will help stretch out those tendons to help get them sliding better in that area so they're not so tight. Another one you can do, since there's those two tendons, they run different ways. Instead of going just straight down, you bring it out and down. So press on it, out and down, then back up. Press on it, out and down, let go, back up. That's what we would start with. And after you've progressed a little bit and it's starting to feel a little bit better, the next progression would be having your hand hang off of something, just like this, and doing the same thing but just going further with it. So you'd press on it, down, let go, up. Press on it, down, let go, up. And then you can do it kind of at that angle as well. Another one that you could do at home is find a small weight, like one of those 3-pound jogging weights, or just something small that can fit in your hand easily. You don't want like a big soup can. But with that, what you would do is, I'll use my water bottle, pretend this is a small weight. You do the same thing, hang it off, and you go up with it. You go down with it, excuse me. You go down with it, we call these negatives. And then you lift it up with your other hand. So down, lift it up with your other hand. And that's basically all you do. You can do 10 to 15 of those a couple times a day. That will help strengthen your wrist as well as help stretch out those tendons there. If those things don't start to help and clear things up, you'll obviously want to continue icing it and things like that. And if it's still very painful and you don't have much range of motion or anything like that, I would say it's time to go see a doctor or a physical therapist. The next steps would be corticosteroid injections, and they seem to work very well for this. It seems to clear it up usually within days. If that doesn't work, the next step would be surgery, where they cut that area open and they just release what they call the retinaculum around the tendon, and it helps those tendons slide much easier. So that's the Quervain's. I hope you enjoyed it, and I hope it was informative, and thanks for watching.